In this video tutorial, we review the templating panel. Once you move to templating, and if auto recommended has been selected under the file preferences menu, the sizes recommended in these blue bands will automatically appear on the screen. However, some factors will not be selected, ones which are user specific, such as the size of head and socket. Select whichever size is suitable, and also profile in this case. The template then becomes fully coloured and is more visible to the user. The same applies to the stem. Once you've selected all of the parameters for the template, if necessary it can be moved, and templates always move in the same way. So if you click on the template, the 4-point handle appears, and by clicking on this it can be moved in any direction required. If you right click and drag in any direction, it will rotate. If an axis line appears in the template, such as this stem, if you click anywhere in the template other than on the 4-point handle, it will move on the axis line only. Other features associated with templates are Align to Wizard. Click this and a template component returns to the wizard positioning, assuming wizards have been used. This will not apply in trauma. There are template properties. A drop-down list here shows the properties box, which can be opened and repositioned on the screen. Alternatively, individual properties can be selected on the fly, and this is done by a quick right click on any graphic where the same features are available. For example, change to colour. Close the properties box when it's no longer required. In the templating screen, any features and sizes associated with an individual template will be shown. 2 templates for total hip replacement, and there is a message box which includes any changes you make to the template position and normally relates to the wizards that have been used. It's possible to add an additional procedure. If another hip was to be planned, choose Add New Procedure, go to the other side, choose Total Hip, select Templates Required if a change is needed, or go straight to Add Procedure. The template will then appear in a non-specific position in the middle of the screen at the default size last used for this particular procedure and prosthesis. If further planning is needed, return to the planning screen to use wizards. Click to move between the screens as required, or of course the template can be moved manually according to the available controls. Other features of the templating screen are different icons, one to edit procedure name, change to contralateral side if the template is to be viewed on the other side of the body. In the case of the hip, a reduction key is available, or it's possible to delete the procedure, such as the last one we added. I'm going to select delete. Now just the one tab for right hip replacement is shown. The reduction icon is now available and can be toggled to show reduction of the hip. There can also be one other icon shown if auto recommend was not selected in preferences to accept recommendations of wizards. Other function buttons in this screen will be covered in session options. This ends the video tutorial on templating panel.